Our next talk is on radiology, which is a huge area of interest for a lot of international doctors. So we're very grateful to have Dr. Shitanshu join us. He's helped a huge number of international medical graduates in their radiology journeys. So thank you, Shitanshu, for joining us. He's been a radiology doctor for a couple of years now, so he has a good understanding of how it works, as well as giving you some insights into how to get into this competitive specialty. So I'll let Shitanshu take over now. So thank you, Shitanshu, for joining us.
Just very quickly, Bridget, before Shitanshu goes, Shitanshu is just on a night shift, so we're super grateful for him to not be asleep right now. And actually be on this and doing this talk. So really grateful.
Yeah, thank you for having me. It's a pleasure joining you again for this talk. And yeah, it's my last night today, so it's okay. It's fine. Right. So for all of you who have joined today, thank you for coming here, and hopefully you'll get a lot of your doubts cleared from this session and the other sessions as well. Okay. Yeah. So welcome to radiology. And a quick mention about myself. So I'm from India, and I graduated medical school in 2018, and I came to UK via the PLAB pathway, and I started working in NHS in 2019, early 2019, in acute medicine. At that point, when I came to UK, I was really interested in doing medicine. So surprisingly, I never applied once for medicine, and yeah, I matched into radiology in 2021, and currently I'm in my third year of training, so still got about 2.5 years to go. So to be honest, this question I don't even need to address this. Why radiology? Looking at the competition ratio, it's just been climbing up and up every year. But yeah, if I have to give you like 4 or 5 points why people are getting more and more interested in radiology. So I think one of the reasons is it's a shorter training pathway compared to many other specialties. It's about 5 to 6 years, except interventional radiology is 5 years for everything else. The other thing is you have a lot of variety. So if you have spent even maybe 5 days in radiology department, you would have noticed the kind of work radiologists do. It's a mix of diagnostic and interventional work. The scope of interventional work is increasing day by day. There is an ever increasing demand, obviously. I mean, if you can imagine, if a patient is getting admitted to a hospital, most of the 90% of them are going to have some kind of imaging. Really bad for us having completed a night shift, but yeah, so the other thing is flexibility, and yeah, so work from home has actually become a reality since COVID, to be honest. Like if I give an example from my hospital, many of my consultants, like I'm in my third year and I still haven't met all the consultants yet, because most of them, they work from home all the time. So it is a big reality, and it gives you a lot of flexibility for your daily life, really. And of course, it's quite well supported training program, which is what I realized during my first 2 years in NHS when I was working in a non-training job. When I looked at other trainees from medicine and surgery, because of the staffing issues and various reasons, compared to that, radiology is very different. It's well supported. It's a very protected environment, and I'll talk about that a bit more later on. And yeah, obviously that's just a pun in there. Yeah, I'm on the other side now, so sorry if you're working in Nottingham and I rejected any of your scans, but you can always call me. This is very important. Is it really for you? Because I'll give you statistically, every year at least 1 or 2 trainees drop out of radiology. So in my hospital itself, in my batch itself, 3 people dropped out of radiology last year. In my seniors batch, there were about a couple of them who dropped out. So it's not for everyone. That's the take-home point. And the main reason which I've observed and which I've tried to understand is, obviously there's a lot less patient interaction when you come into radiology. It's more of like, you're just behind the screens and you're just sitting behind your computer and doing most of the things there. Of course, there is a role of intervention, but again, you don't spend much time with patients. So a lot of people start missing that. So my advice would be, even don't just, I understand radiology is very competitive. Everyone speaks good about radiology, including myself, but try and spend a week in radiology to understand would you actually like being in radiology. Okay. So if I talk about the training itself, it is 5 years. And as I mentioned earlier, it's 6 years if you're doing interventional radiology. I'll talk about the other subspecialties in a moment. It's a run-through training. So basically, once you enter the ST1 year, you don't have to take any more interviews, and you will get a CCT, which is Certificate of Completion of Training, at the end of your training. All right. So unlike a lot of other specialties, for example, medicine, surgery, where you get into core training first, and then you have to reapply to get into specialty training. So that's one good thing about radiology. You have 3 exams which are taken during your training. Part 1 is taken during your first year, and you are expected to pass part 1 by the end of second year. So you are only allowed 4 attempts at each step. So you have to definitely pass all these steps in 4 attempts each. That's the maximum number of attempts allowed. If you don't, obviously, then they might take you out of the training program. Part 2A and 2B are taken during the 3rd year. So I'm going to take 2A very soon, next month, and then 2B after that, if I hopefully pass 2A. The exams are a bit difficult because part 1 is going to test you on physics, which a lot of us hate, including myself, and anatomy and radiological anatomy. Part 2 and 2B is core radiology. So radiology is obviously something we don't really read much about during our medical school years. So you feel like there's lots to learn, and it's a steep learning curve. And from ST1 to ST3, you will be doing general radiology, as in you will be rotating between different blocks. And from ST4, you get to choose your subspecialization. So I'll talk about that in a moment. And as I mentioned before, you have a really protected working environment. So even an ST5 will have his or her reports checked by a consultant. So it's a very, very protected environment. If I talk about the typical day, the roles for ST1 and the role of ST5 is very, very different. So ST1 is very, very academic. So because again, you don't know much about radiology when you join the first year, and they don't expect you to know anything about radiology. So don't worry about that for the interview part. So when you join ST1, you're learning the radiological anatomy, and learning to interpret different kinds of scans. So there's lots to learn. Plus, you've got a really difficult exam to pass as well. So you won't be doing much of reporting in ST1. You will be learning, you will be sitting with consultants, and you will be making like your own reports by just saving them. Okay, so ST1 is very, very academic. From ST2, your responsibilities go up, and in many hospitals, including Nottingham, we start doing nights from ST2. So it's a sudden jump from, not doing much to doing a lot. And yes, all the reports for the CTs and MRIs, they're checked by a consultant. So even if you miss something, obviously, it will be picked up by someone. The on-call pattern. So a lot of people think that radiology is going to be super chill. There won't be any nights, but no, that's not true. There are some deaneries. There are a few deaneries where you don't have to do nights at all in all of your 5 years. There are some deaneries where you start nights from 3rd year. So it's very different, the on-call pattern across different deaneries. But in Nottingham, you start nights from ST2. And generally, I have about 7 nights in a total of 3 months. So that's how my on-call pattern works. And I do 2 weekends in 3 months. So I don't think so it's any busier than that in any other deanery. So this is as busy as it can get, your on-call rota. So talking about who can apply. So anyone who has completed their FY2 training or equivalent is eligible to apply. So what this means for IMGs is, if you have passed your PLABs or you've passed any other MRC examination, the main thing is you need GMC registration to apply, just like any other training program. So, and you will need a CREST form, which basically proves your F2 competency, just saying that you're equivalent to a F2 doctor in UK. So you can get that signed from back home as well. Or what I would recommend, what everyone recommends, is apply for some non-training jobs, get some NHS experience, see how NHS works, and get your CREST form signed while working in your NHS hospital. That would be a much better option rather than applying straight to a training program. And yeah, you don't need any prior radiology experience. They are not going to ask you questions about interpreting X-rays or CT scans. They are just expecting you to have some basic medical knowledge. That's all. And yes, you need to have GMC registration before the date of start of your training. So let's say if you're an IMG who is about to take your PLAB 2 exam and the applications are opening in November for all the training programs, you can still apply, but they will give you a deadline before which you need to have your GMC registration ready. Otherwise, your application will be taken away. So this is what I was talking about previously. Now, these are all the different radiology subspecialties. So as I mentioned, for the first 3 years, you'll be rotating into these different subspecialties of radiology. And it's just obviously to get to know more about each specialty and at least do some basic reporting, which you will see on call. So you need to learn how to report a CT head, a CT abdomen. So you will always be reporting that during your on calls. But in your last 2 years, you have the option of choosing any one of these subspecialties. So you have to definitely choose either MSK, pediatric, chest radiology, it's up to you. If you're choosing interventional radiology, that's going to be 3 years instead of 2 years. So if you're going to become an intervention radiologist, your training will be 6 years instead of 5 years. Now, in some deaneries, for example, Leeds, which is a very competitive deanery, you might have to take an interview within your deanery to actually get into one of these subspecialties. For example, let's say there are 10 people in your batch and 5 of them decide to do interventional radiology. So that it is possible that that deanery doesn't have that many positions to accommodate everyone. So they might take into account your portfolio, they might take into account an internal interview to decide who are they going to offer this post. So I have seen some seniors in my hospital who were previously in a different hospital, and because they couldn't get into interventional radiology over there, so they moved to Nottingham, where they were able to achieve a intervention post. So it is possible, but in Nottingham, until today, no one's ever been denied a subspecialty of their choice. So if you are choosing Nottingham, you can choose anything you want, really. No one's going to say no, and there's no interview. Anyone can choose anything. So the competition ratios, yes, this is something, obviously, if I talk about the competition during my time, which was 2021, there were about almost 1,700 candidates for 358 positions. Now, Dr. Anoop mentioned in his previous talk that UK is not going to increase the number of training positions, unfortunately. So the training positions are going to remain the same. So last year, just over 3,000 candidates applied for radiology, and the number of posts were less than what were in 2021. So that brings the competition, that doubles the competition ratio. It was about 4 to 5 when I applied, and it's about 8 to 9 at the moment. So it's a very high competition rate. And yes, for obviously different reasons, which I've talked about here. But the good thing is it's equal for everyone. Competition is still equal. It's fair. You're going to take the same exam. You're going to take the same interview, and everyone is assessed equally. So even if you're an IMG, it doesn't matter. No preference is given to local graduates. So you have all, you should just take that into account as well. Yes, the competition ratio is high, but because you have an equal chance, you shouldn't hesitate into applying into any competitive specialty like radiology. So I'm sure a lot of my colleagues will mention this again and again. So the applications generally open in November for most training programs. You will be taking the MSRA exam in January. For radiology, the interviews are usually held in February or March, and the training will start in August or September. In most deaneries, it starts in August, and in some deaneries, it starts in September. Now, since the last 3 years, interviews have been virtual, and I'll talk about that later on. So these are your basic 3 tasks to enter radiology. You've got your MSRA exam. You have to prepare a portfolio. I'll quickly show you the portfolio briefly at some point, and then you have to take the interview. So the MSRA exam, I'm not going to talk much about it because Dr. Arora, he's going to cover this in his talk as well, and I think he's the best person to guide you about that. But yes, it is the same exam for all specialties. So even if you're applying for 6 different specialties, you just have to take the exam once, and your score can be used for all the 6 specialties. It is a computer-based exam. There is no fees. and it can be taken outside UK as well. There are some centers outside UK. It consists of 2 parts. This is a sample example I've taken from their website, which is if you're an IMG, if you've taken PLABs, you would possibly relate to these kind of questions. They are actually easier than PLAB 1 questions. And that's why this exam is very competitive, because you have to score as much as you can, like anything about 90%. And these are all the kind of like PLAB 1 again. This is the curriculum of the MSRA exam. And this is an example question again of the situational judgmental test. So you will be given a scenario, and then you have to rank these of options from the best to the least appropriate. So I'm not going to talk much about these. So talking about the cutoff score. So now, because radiology is very competitive, so the cutoff score last year was around 538. That was the last person who was called for an interview. When I got into radiology, so I actually got in my second attempt. In my first attempt, which was in 2020, the cutoff score was 480. In 2021, when I managed to get into radiology, the cutoff was about 520. Last year, it was almost 540. So you can see the trend, how this has been increasing. So in general, so 500 is considered as an average score generally for all the specialties. So anything above 580, I would say, is really good for radiology. Now, obviously, if it was 2 years ago, I would have said anything above 530 or 540 would have been a good score. But now, looking at the cutoff scores, it's definitely aim for anything above 580. Okay, and the more important thing is that the MSRA score is going to make about 1/3, or maybe even more than 1/3. It's about 40% of your total application score. So when I mentioned you've got MSRA, interview, and your portfolio, MSRA is going to make up a big chunk of your total score. So you really, really need to get a good score. And the other thing is you need to at least have the cutoff score to be even invited for a radiology interview. So you could have the best portfolio out there, but it's not going to matter as long as you don't get the cutoff score in MSRA. So portfolio only comes into game when you actually get this cutoff score and when you get an invite for your interview. So that's why MSRA is really, really important. And I'm sure Dr. Arora will go over how to prepare for this exam, and he's got some amazing resources for that. But talking about the portfolio, now again, this is something they have changed drastically since I applied. My portfolio during my time was so easy. I managed to prepare it within 4 months. Nowadays, it will take at least 6 to 8 months easily. It is available on Oriel, so I think they will be soon advertising all these posts on Oriel, which is the official website for applying to these training programs, and they will send out. They will attach this portfolio along with your specialty. But yes, portfolio is something which is completely in your hands. Okay, so you have to try and gain maximum points here. And ideally, as I said, you need to spend at least 6 to 8 months. So even if you've not started preparing anything now, you still have a good amount of time, because from what I recall, last year, they asked everyone to upload their portfolio by February. So we are still in October. There's a good amount of time to get most of these things done. And I'll show you the portfolio later on if we get time. But these are the basic, easy things to achieve for your portfolio. Taste a week in radiology. If you have done a taste a week, if you've spent like a week in radiology department, even in your home country, that is going to be accepted. It's fine. Ideally, I would still say do a taste a week here in UK as well, because UK radiology department works really different than what it might be in your country. So absolutely do that. And to be honest, you can just use your study leaves to apply for and you can get a week off from work as well. Audits, something again very easy to achieve. You can do this while you're working anywhere in the world, or if you're working in NHS, it's very easy to get an audit. I do have many juniors in my hospital who have approached me to do an audit, and I am going to do a few with them, with a couple of them. So you can always approach radiology registrars or any consultants in the department and ask them if they are interested in doing an audit. Because the thing is, as a radiology trainee, we have to do one audit every year. So I'm sure most of us would be keen and happy to do the work for the audit and just take our name. Teaching. So for the purpose of radiology, teaching even school students is accepted. You can get a good amount of points for teaching school students or teaching in community. So it doesn't necessarily have to be teaching medical students. Okay. Publication, you just need one publication, and it doesn't have to be a PubMed index publication. It just has to be in a peer-reviewed journal. Simplest way to get a publication, what I did was I asked for some interesting cases from my seniors, and I made a case report and submitted it to a peer-reviewed journal. So that's the easiest way to get a publication. Obviously, there are very reputed journals like British Journal, but that will take good amount, like you will need a consultant with you for that publication. So if you're looking for something quick and easy, that's the way to go, what I did. You can use any prizes you have been awarded in medical school. If you had any events in your medical school or your local, like local university, and if you're awarded any prize, you could use that as well. So talking about interviews, yeah, it has been virtual since the last 3 years. So I think when I applied to radiology for the first time, that was the last time it happened in person. So where we had to suit up and go to London and take the interview. Obviously, I messed up that one. I didn't get in that time. But yeah, from after that, it's always been a virtual interview. So you will have 2 examiners on the panel. So you'll be logged on the screen on your laptop, just like today. And it will last around 10 to 15 minutes. My interview was about 12 to 13 minutes. It isn't long. Now, the thing to remember is those people, those examiners on the panel, they have not seen your portfolio. So whenever you get the chance, you have to talk about what you have done in radiology or anything related to radiology, because otherwise they will never get to know your experience. Now, interview is very generic because I mentioned this before. You do not need any prior radiology experience. No one is going to show you on their screen like, okay, tell me what's going on in this X-ray. It's not going to be like that. Okay, it's going to be very generic. They will always ask you why you are interested in radiology, what makes you, and what skills you have which you could bring to radiology. These are very generic questions which can be asked in any specialty. And then obviously there will be a few ethical scenarios, and it's very, very general, the interview. It's not really about radiology. So this is a quick mention for any IMGs today who have already done their post-graduation in radiology or are planning to do post-graduation, or they are still pursuing it in their home countries. Now, there are 3 options really. So the first thing is you can, if you get GMC registration either via FRCR or either via PLABS, you can actually apply for ST3 or ST4 training posts. Now it's a bit difficult, and it's going to be a longer pathway in my opinion, because the requirement for ST3 radiology post is you should have at least 2 to 3 years experience after GMC registration. So once you get your GMC registration, you need to have 2 to 3 years experience, and then you can apply for ST3. And then again, it will be ST3, 4, and 5. So that's 3 more years. So it's going to take a lot of time. So instead, what I would recommend you to do is try and pass all steps of FRCR during your training or maybe after your residency. And once you've passed all steps of FRCR, using your FRCR, you can get GMC registration, and then you can apply for different jobs. Now, there are 2 kinds of jobs which are available. Either you can apply for a senior fellow job. Okay, you will be called a senior clinical fellow, or maybe a senior trust doctor, something like that. It's basically a senior level job. You will be working at the level of ST4 or ST5. Or the other option is, if you are confident and if you have a lot of experience, you can apply for a locum consultant post. Now, this is not a permanent consultant post. It is for someone like you who has experience, who has passed FRCR but have not done training from UK. So this is a pathway called Caesar pathway. So for example, I am a UK trainee. So once I complete my training, I'll get CCT. That's what all UK trainees will achieve at the end of their training. But for people who are coming from their home countries or have done post-graduation there, they cannot go through this pathway. It's called Caesar pathway. Now, in my experience, the people I know who have taken this pathway, it takes about 2 to 3 years to get your Caesar signed off. So in very simple terms, what this means is you start working in a hospital and you have to prove your competence to the other